Hello, my name is Chloe Atreya from the University of California, San Francisco, and I'm going to summarize key points from some of the most impactful abstracts at the ASCO 2021 meeting pertaining to metastatic colorectal cancer. The first abstract is 3500. That's the Keynote 177 trial that was presented by Dr. Andre. And this trial has established that pembrolizumab is a standard of care in the first line for patients with mismatch repair deficient or microsatellite unstable metastatic colorectal cancer. This trial previously led to an FDA approval of pembrolizumab in the first line, and in 2021, the overall survival data were presented. So as compared to chemotherapy, pembrolizumab resulted in superior progression-free survival, fewer grade 3 or greater treatment-related adverse events, and better quality of life. It was presented this year that there was a non-statistically significant reduction in mortality, and this was likely related to crossover from the chemotherapy to the pembrolizumab arm, with about 60% of patients going on to receive pembrolizumab. Briefly, the next abstract is 3502, results of the FIRE 4.5 study that were presented by Dr. Stinsing, and this is a randomized trial to investigate FOLFOXIRI plus either bevacizumab or cetuximab as first-line treatment of BRAF V600E mutant colorectal cancer, metastatic colorectal cancer. And this is the first prospective randomized trial data to support use of first-line FOLFOXIRI plus bevacizumab in BRAF V600E mutated colorectal cancer. And that was versus use of FOLFOXIRI plus cetuximab. So this trial is in favor of use of bevacizumab. And then abstract 3504, these are results of the Focus 4N trial presented by Dr. Adams. This was looking at capecitabine versus active monitoring for patients with stable or responding metastatic colorectal cancer after 16 weeks of first-line treatment. And results of this study were informative for shared decision-making. As compared to active monitoring, capecitabine can double the time to return to full chemotherapy. On the other hand, the capecitabine is more toxic than active monitoring, although patient-reported quality of life survey results were similar, and there was no significant difference in overall survival. Then last but not least, the final results of the Destiny CRC01 study that were presented by Dr. Yoshino found that trastuzumab deruxtecan is active in HER2 amplified colorectal cancer. This is now listed in the NCCN guidelines. The confirmed objective response rate was 45%, with a median duration of response of 7 months, a median PFS again of about 7 months, and a median overall survival of 15.5 months. This was specifically for patients with HER2 3+ by IHC or 2+ by IHC and positive by ISH. There were no responses in the HER2 lower amplified groups. And this trial specifically included patients with RAS and BRAF wild type tumors, and these were heavily pretreated patients. Importantly, this drug is active even after use of prior anti-EGFR therapies. Overall, the toxicities were manageable. However, it's important to look out for interstitial lung disease or pneumonitis. Those are the highlights. Thank you.